Dr. FJ with Gardner, Schofield Chiropractic. Heidi here, she's just going to tell her story on how she responded to NUCCA and the corrective process we go through.
Okay, I came last June because I was having pain in my left knee, pain in my right hip, and I had known from previous chiropractic care that my hips went off easily and my legs were of different lengths. And it was causing me trouble walking, difficulty sleeping, and actually I just retired in June and I decided this was going to be my gift to myself, to come to Dr. Schofield, because I had heard so many incredible things about him from people in the community. So I came and started with him, and he did some x-rays on me and then told me about the NUCCA method. Well, I'm a healthcare professional, and of course I looked that up and I thought, what is this and how is it different from what I've had before? I also filled out a form that asked me some questions, and what did I like and what didn't I like about my previous care, and I didn't like being cracked. I didn't like aggressive changes, and this was a very gentle approach. It started at the neck, and clearly I could see I was off. From the x-rays I could see I was off or misaligned, and I wanted more than anything to be aligned. So I said, yep, I'm going for it. And one thing I read and was told is this is going to take some time. There's a partnership involved. I had to do my part. I had to follow the instructions, and little by little by little, things started to change as he worked on my neck. Nothing was painful. Nothing was aggressive. And everything they had said I'd probably feel some achiness, some tiredness, I felt, and I went with, because everything was explained so well to me. I came early one morning for the long term. It took about an hour and a half for the adjustment, and I felt so grateful that after an hour and a half, when another x-ray was taken, they found that I was in alignment, and I was bound and determined to stay there. So I read carefully. That meant I changed a dental appointment because I didn't want my neck to be out of position. When I got my hair cut, I did not tip my head back in a bowl. I just recently flew, and I made sure I didn't cock my neck at all. And here I am 5 months later, and I said to Dr. FJ, this is my best accomplishment of retirement. I am still in alignment, and I feel so good. I can exercise more. I can walk with much ease. I sleep better, and I feel really, really good. So I am very appreciative of the NUCCA method and Dr. FJ.
Well, thanks, Heidi. Thank you for sharing. And there it is. And she followed and did everything unbelievable. And when you're in alignment, the body will heal itself. Sometimes it just takes time. So I always start by checking first the leg length. Now Heidi's holding, so her legs will be balanced. She's in alignment, so we're not going to adjust today, but I'll show you if we were to adjust her what it would look like. So her legs are balanced. If one was short, with her we know that her right leg goes short. That's when she's out of alignment. If her left all of a sudden goes short, something would changed, and we'd have to re-x-ray her. So then we'll have Heidi sit up facing that way. I like to do some scanning palpation just to feel the tension. It feels really good. Then I'll have you stand up. Then we check posture. You want the head centered over the tailbone. Here's our shoulders are pretty level. You don't make everyone totally perfect, but she's looking really good. So if we were to adjust her, how we do the NUCCA adjustment, have you come around your left side. everything comes from the x-ray. So on how to adjust. The posture lets us know if they're in or out of alignment, lets us know when we've made the adjustment, when we fixed it. But the x-ray is how we know where to adjust, what angle. So from her x-ray, we know Heidi's a high 3 with no rotation. So I take it, and I know exactly where her atlas is, also from x-ray. We use markers. So here, her atlas is right there. So I would come down. I'm not going to do it, but then I would be like this, and I would just place my hand very lightly at the transverse process, the part atlas, and I would hold it, and just keep doing that. Basically sliding the head and neck into alignment. And you can feel tension or resistance is the feedback we get when you use the hands, and you can feel when the tension disappears. Then you know you made the adjustment. Okay, good. These are the x-rays Heidi was referring to. So we adjusted her for about an hour and a half, actually. I mean, hers took quite a while. There's a lot of resistance in the spine. But this is when she started, so she was right to 2.59 atlas laterality with head tilt of about a half, 0.49, and then a lower angle of 2.3 degrees with angular rotation, so the neck off center of about 0.2 degrees, and a plane line of 2.6 16ths of an inch, so that's the atlas kicked up. Then after, she went to 0.49 atlas laterality, just under 1.25 lower angle. Head tilt was now going to the left. Ideally, you want opposite. So you'd like to have a right atlas and left. If it's not going to be zeros, then you want as close to opposite angles that are equal. So like right 5, left 5, or as close to that as possible. And then she had no angular rotation, so the neck was centered in gravity. So it was a nice correction. When the head goes off center, this is tricky. This is where a lot of people go after it again, and you can change the subluxation or create another subluxation, which means create a different misalignment. So her posture was clear, her legs were balanced, there was no tension in the spine. So I left her, and she's done great. So everyone's not going to be perfectly straight. You want to get them to their normal, and then their body will be able to function normally and heal itself. So this is what's fantastic about orthogonally based upper cervical techniques like NUCCA, orthospinology, Grostic, AO, is the post x-rays I absolutely love. And post x-rays on one visit. You can fix someone's alignment on one visit, and then you see how long it holds, and as it's holding, it's healing. And then we do other techniques to adjust a knee or a hip, or work on the soft tissues, or work on discs, and that's what that all combined with NUCCA is part of our corrective process, which is what Heidi went through. So yeah, this is what makes it so fun, is the results people get and how it completely changes their lives. And yeah, and that's it. So Dr. F.J. Schofield, West Bend, Wisconsin chiropractor, and we'll see you next time.